Domestic and Sexual Violence Against Patients with Severe Mental Illnesses by
Liz Avila.
Jackson Jennings.
Michael Rivera.
Summary. In London, 303 psychiatric patients were randomly recruited and interviewed using the British Crime Survey Domestic/Sexual Violence Questionnaire. The results were compared to a general population of 22,606 from the National Crime Survey in 2011 and 2012.
Literature review. The study was done due to the fact that the majority of studies concerning patients with severe mental illness and violence were about the patients committing these violent acts. The researchers believe that these numerous studies have been a big part of creating the stigma towards this group. The study aimed to collect data on acts of domestic and sexual violence committed against patients with severe mental illness, commonly referred to as SMI. These types of violent acts have significant negative effects on the physical and mental health of victims, and it was hypothesized that it would have an even greater burden on the health of SMI patients. The study compared the occurrences of domestic and sexual violence within both the general population and the population of SMI patients. These three hypotheses were tested. 1. SMI patients are more likely to be victims of domestic and/or sexual violence. 2. Family violence comprise a greater proportion of domestic violence among victims with SMI than general population victims. And 3. Violence would lead to greater adverse health effects and less disclosure among victims with SMI than the general population's victims.
Data and methods. The patient sample was recruited through two National Health Services, Camden and Insling NS Foundation Trust, and the South London and Malsey NS Foundation Trust during September 2011 and to March 2013. The compared group was restricted to 18 to 59-year-olds and have completed the domestic and sexual violence module, whom also lived in London. Each interview was done by one of the 6 selected professionals: 3 psychologists, 1 psychiatrist, and 2 research assistants. Patients who wished to not discuss with a professional were allowed another option to use a paper-based questionnaire. The responses were electronically entered after the surveys were turned in. The main outcomes were being a victim of domestic violence or sexual violence in the past year and since the age of 16. Extensive questionings for the victims of serious sexual assault, rape, or attempted rape were asked about their psychological state. Did they have a physical illness or injury, any suicidal tendencies, or psychosocial problems? The graph represented the patients and controls the general population, split by gender. Females are shown to be at a much higher risk than being a victim than males, but males are still at some sort of risk.
Results and conclusion. Domestic violence. There is an overall correlation between mental illness and physical abuse. Males are also overwhelmingly at lower risk of abuse. Comparing SMI patients with controls, adulthood domestic violence was reported by 69% versus 33% of women. The relative odds for each of the different forms of lifetime DV, which are emotional, physical, sexual, or partner and family, were elevated around 3 to 4-fold among men and women with SMI at the 5% significance level. Past year domestic violence was reported by 27% versus 9% of women with and without SMI, respectively, with elevated odds for both partners and family violence among women with SMI. This also includes a 13 versus 5% chance of men also being abused. Among victims of domestic violence, a greater proportion of victims with SMI than control victims experience family violence at about 61% versus 32% among women and 65% versus 41% among men. In general, there's a greater chance for SMI to report domestic violence. Results and conclusion. Sexual abuse. There's an almost 3 times increase for women and 8 times increase for men if they are affected with SMI. Among all women, there's a 6 to 9 odds of sexual abuse, 2 to 3-fold elevated chance of partner violence, and 30 to 40% elevated odds of family violence if they are SMI. They are more likely to report suicide. However, they are also more likely to report their findings to police or other personnel in charge of their care. Comparing SMI patients with controls, adulthood sexual assaults were reported by 61% versus 21% of women and 23 versus 3% of men, respectively. Past year sexual assaults were reported by 10 to 2% of women. However, absolute numbers among men were too low to allow for stable estimates. Conclusion. Men and women with SMI who are under the ongoing care of psychiatric services are 2 to 8 times more likely to experience sexual and domestic violence than the general population, with a high relative burden of family violence. Women with SMI are more likely than women in the general population to suffer psychological ill health and attempt suicide following sexual assaults, but most do not disclose violence to healthcare professionals due to reasons of mental illnesses or a general lack of understanding. Healthcare professionals need to consider victimization as a potential trigger for suicide attempts among patients.
Improvement. My personal improvement is that their way of collecting data was very questionable. Considering the title of the thesis is that it's severe, patients with severe mental illness, there can be that possibility that patients could be making up their acts of domestic violence, things like that, just based on how they perceive the world. Like maybe someone reaching out or giving them medicine could be violent to them. So you have that barrier of the idea of the fact that line of, are they telling the truth? Or are they telling the truth based on how they perceive it?
Another potential improvement that could be made upon this project is that the study did not report or understand circumstances past 1 year. There's a whole lot of unknown data that is hard to correlate with the rest of your life when 1 year is your basis for research. Another thing is that the research response rate was only 50%, so there is not enough responses being accurately recorded, which could lead to skewed or even biased data.
Another improvement could be to use studies not from the same time span like the ones included in this. Most of them were done from 2011 to 2013, possibly use studies from earlier in the century or even before. Another improvement would be to include studies involving a higher amount of patients. Compared to the general population, the number of patients was incredibly small.